Economic inequalities are still a major problem in South Africa's healthcare sector.
What you end up having is a situation where in the poor, marginalized areas, the rural areas, people there can't actually access skills.
Let's talk to Prof. Vukosi Maravate.
Here at the University of Pretoria, I run the Data Science for Social Impact Research Group, and 70% of the work has now shifted mostly to working in language. We mostly work on AI in African languages and use cases for low resource scenarios. One of the areas I'm very interested in is the news area.
Go tlisetsa kgaso ya dikgang tsa Setswana dithankgololo ka gore puso e tsweletse go bona tharabololo ya dikgetsi tsa botlhole mo dijong.
Can we have news content that's available in our languages? And then can we start processing it for different things? So one of the things that you might want to do that seems very simple is just having metadata that just tells you, here's a news story, this news story is connected with this topic.
So let's say, for example, you want to use a model that does news classification for you. So this model deals only with this Setswana news classification. You can enter a Setswana text here, and then it will categorize it based on what is the essential content. Let's try and find Setswana text.
This
lady is talking about tuck shops having poisoned food. So we're going to use that text. It identifies that there's some kind of infringement of the law, talks about the economy.
So one of the things we've been interested in is how can you build FAQ systems? We wanted to use large language models in African languages to be able to take questions that were being asked, check the FAQ, and then be able to respond and do that completely in their language.
Firstly, you must remember that in the African culture and most of the African languages, we are an oral culture. We are an oral society.
When it came to thinking about the experiences that people might have in the health system, how are you going to find examples of people talking or interacting about the health system in such a way that you've got that text in the way that they would actually converse, and then being able to respond with information that's actually relevant to them?
Good morning and a very hearty welcome. I'm Dr. Victor Ramatisi.
Yiphi indlela engeza ngayo
yakho ngishekhe oxygen yakho
kajeno re bua ka di ultrasound.
We have a national broadcaster in South Africa, the SABC. So the nice thing is that they have a lot of medical actuality shows, right, where they might have a doctor or a health specialist speaking to the public and the public responding. For us, that's a great source because it's a natural speech. And then if we can transcribe it using some tools, we can then get the text. And then from that text, we can then see how do people actually discuss a specific ailment or anything like that. It's such rich information about how do you speak about health. And there could be so many different ways that this could actually be helpful later on if we use machine learning, we bring in linguists, and then we start actually creating tools that could assist people in talking about health in something like Setswana or Sepedi and Sesotho.
When it comes to health, we need the computers to be programmed accordingly using our indigenous languages in order for us to get the message across.
We're still trying to have conversation with SABC about making their content archives much easier accessible for researchers, especially for public benefit.
On behalf of the EU and its member states, we reiterate our commitment to progressing towards the conclusion of a meaningful broadcasting organizations treaty.
How would you feel if I tell you that there is an international treaty being negotiated which would say that even if you do have fair use and fair dealing rights under copyright, those will not apply to broadcast material because there'll be a new exclusive broadcast right.
Having very narrowing on availability of using broadcast, I think, will ultimately impact those in spaces where there's not really a lot of data that's available for research in the first place.
If there's going to be a broadcast treaty, right now the scope of the rights are very broad. There's 4 different articles that give new exclusive rights to broadcasters, meaning that, like copyright, you would have to ask permission from the broadcaster to record their signal, essentially.
If members agree, it's a question of political will. They can go ahead and start negotiating in a diplomatic conference, perhaps. But this has not moved to a diplomatic conference, and nobody seems to be even thinking of a diplomatic conference at this stage on the broadcasting treaty.
Ha ile hantle, o ka theola ho ba kotsing ya lefu la tswekere.
UNESCO released a paper where they mentioned that when the century ends, you might actually find that 3,000 languages are going to go extinct. So when you look at it, this is very important for language preservation.
The main objective is to empower people, right? For them to be able to have access to these technologies so that they can use computers in their own native languages rather than having to use them in a different language that might be foreign to them.
If you're not recording, is there now 24/7 people writing and scribbling as the live broadcast is happening? We have to be able to press record on what's out there. For us is to improve AI systems, but then I think there's many, many more use cases than that.